Association of the Northeast, and I work here out of our Augusta, Maine office. I want to welcome you to the release of our 13th annual American Lung Association Tobacco Report Card. Some of you may remember that in 2005, Maine became the first state in the nation to receive straight A's in 4 areas graded by the report card. To date, no other state in the country has achieved that status. Unfortunately, since that time, our grades have been slipping each year. This year, we're not even on the honor roll. The tobacco report card grades each state in 4 areas: investment in preventing tobacco use compared to the Federal Centers for Disease Control's recommended level, protection of people from secondhand smoke, access to cessation services for state employees and Medicaid recipients, and the level of taxation on cigarettes and other tobacco products. We were once the national leader in tobacco prevention, but no longer. Maine's grades have been slipping for the past 7 years, and we need to put a stop to this downward trend. It's well within our ability. Maine has an obligation to use our tobacco settlement money, the Fund for Healthy Maine, to prevent youth from starting to smoke and to help smokers quit. We receive more than $50 million from the master settlement and more than twice that much in cigarette excise taxes each year. We cannot stand by and watch Maine slide back to where it was in the mid-1990s, when our state had the unwanted distinction of having the nation's highest youth smoking rate. We have much to be proud of, but we have much work to continue in order to continue progress. For those of us who are parents, you'll quickly recognize the tactic that I'm about to use. When you get a bad report card, always start with the best grades. For the 10th consecutive year, Maine's received an A in our efforts to protect people from the exposure to secondhand tobacco smoke. We have the fewest public places of any state in the nation where you are at risk of being exposed to secondhand smoke. For these policies, we salute the many members of the Maine legislature and Maine governors whose decades of commitment to protecting public health have made this possible. We were also encouraged by the work being done by the Healthy Maine partnerships in communities across the state to ban or restrict smoking in public housing, on public beaches, trails, and parks. On last year's report card, we received a D for tobacco cessation coverage for Maine Care recipients and state employees. 3 years before that, Maine was cited by the American Lung Association as the best state in the nation to quit smoking. But the following year, serious cuts were made to the cessation program. We're pleased to report today that the Maine legislature last year passed legislation that restored our ranking as one of the best states in the nation to help smokers quit. The legislature's action was based on sound scientific evidence of the effectiveness and cost savings from removing barriers for smokers who want to quit and providing them with all the tools needed to be successful. The world-class tobacco helpline managed by the Center for Tobacco Independence, with support from the Fund for Healthy Maine, continues to be a vital part of our statewide treatment network. This year, Maine received a D for our level of investment in tobacco use prevention. Maine is no longer one of those states in the nation that provide close to the funding level recommended by the Federal Centers for Disease Control to achieve maximum impact to reduce tobacco use. Our current level of support is slightly over half of what CDC recommends. So it's clear why the American Lung Association and our public health partners across the state are very troubled by the governor's budget proposal to move funds away from tobacco prevention and control. The reason Maine and other states receive master settlement dollars is because of the deceptive practices of the tobacco industry and their efforts to addict our children. While we have made progress, this industry is still out there working hard every day to attract replacement smokers. Now is not the time to raise the white flag of surrender. Finally, Maine's grade on tobacco excise taxes remains a D. We have declined from being one of the nation's leaders in keeping cigarette prices high. Every other Northeast state except New Hampshire has passed us by. New York leads the nation with a tax of $4.35 per pack, followed by Massachusetts at $3.51, Rhode Island at $3.50, and Connecticut close behind at $3.40. Only New Hampshire is behind us at $1.78 a pack. Why are high cigarette excise taxes important? Because they keep the price of cigarettes high, and that is the most effective strategy to reduce youth smoking and to motivate smokers to quit. This is not speculation. We have over 25 years of proof, as you can see from the graph on my left. When the price of cigarettes are increased, per capita sales fall every time. State revenue also increases every time. Why does Maine need to look at our tobacco excise tax? Our youth smoking rate is still too high. We need to get back on track. Back in 2007, Maine was a leader in helping parents protect their children from tobacco addiction. After more than a decade of dramatic and steady decline in Maine's youth smoking rate from nearly 40% in 1997 to 14% in 2007, over the past 7 years, we have stalled. We all share the responsibility to confront this problem. Doing nothing is not an option. Failing to act now to further reduce youth smoking rates will have a dramatic health and economic impact in Maine. Premature death and disability and disease implications of a rise in the number of new smokers are obvious. Tobacco use already costs us over $800 million a year in health care costs, including $260 million for Maine Care alone. The short and long-term impact of a rise in youth smoking rate will be substantial. And there are serious business implications. When Maine led the nation in youth smoking rates during the late 1990s, the Maine Development Foundation cited this indicator as a red flag against achieving our long-term economic goals due to the negative workforce impact. So today we're calling on the Maine legislature to take strong action to once again drive down our youth smoking rate. We need them to do two things. First, protect the fund for Healthy Maine and resist weakening our investment in tobacco prevention and control efforts. This is crucial. We salute policymakers for their consistent bipartisan support of the fund for more than a decade. This is not the time to walk away. The problem has not been solved. Second, increase the cigarette excise tax by $1.50 a pack. This is without question the most effective and rapid response to quickly drive down youth smoking rates. That second recommendation will not be easy for many in this building to embrace. But our call for an increased cigarette excise tax is directly related to two critical business issues that many in this legislature care deeply about: jobs and health care costs. Failing to drive our youth smoking rate down will not only assure an increase in future health care costs, but will undermine the hard work being done in Maine to help our small businesses grow and create more jobs. Small business drives the Maine economy. These same businesses, though, also struggle with some of the most high healthcare costs pushed by high smoking rates. Keeping the price of cigarettes high by increasing cigarette excise tax is good health policy and good business policy, unless, of course, you're in the tobacco business. We have evidence it works to reduce youth smoking and help people quit. It saves lives and money. We anticipate there will be lively discussion about taxes over the next few months. We're asking legislators to include a tobacco tax increase in these tax reform discussions. Funding generated from a tobacco tax increase can also eliminate the need to make the false choice between funding disease treatment at the expense of disease prevention as proposed in the governor's budget. We can and must do both. Thank you. Happy to take questions.
Ed, I just have one. The governor's budget has taken $20 million out of the Fund for Healthy Maine over the biennium. Given that action and his general position on tax increases, I guess how likely do you think that this proposal was going to fail when it's presented to the governor's office? On the one hand, he's taking money out of the Healthy Maine Fund. On the other hand, he wants to have a larger discussion on taxes.
Well, I think so far the discussion around taxes in the State House here has been very interesting, and a lot of things that people didn't expect to happen. So I think taking it as a whole and looking at overall tax reform, this is the best time to do it. A single bill just to deal with raising the taxes is probably never going to go anywhere in this environment. But in bigger context, we were also very encouraged by the governor of Kansas, and he's proposing a cigarette excise tax increase there, and he's doing some of the same kinds of things that people are trying to do in this state. So we don't think it's impossible. We think it's definitely worth talking about. It's not just tax policy, it's really health policy as well. We know that it will have an effect on youth smoking rates and helping adults quit. Other questions? If not, thank you very much. Appreciate it.